Part 3 of Module 2, the working environment. We're going to start by addressing some emergency situations that you may come across either in your home environment or workplace. Objectives. Identify different medical emergencies at a nursing facility. Describe a standard resident unit and equipment. Describe methods to safely transport residents. Serious medical emergencies can occur at any time or anywhere. These are examples of the most serious medical emergencies. When an emergency occurs, try to remain calm. Call for help right away. Prior to attending the person with the emergency, always make sure that the scene is safe. After this, start to assess the situation. What is the time and what has happened? You can also start assessing the victim. Are they conscious? Are they alert and oriented to person, place, and time? Are there any injuries? Are they breathing? Do they have a pulse? Are they bleeding severely? All of us can give basic first aid if we come across an emergency. This could mean putting pressure on a wound using a gloved hand. In an emergency, we do only what we have been trained to do, because by doing more, we potentially cause more harm than good. In our facilities, we will follow what our policy and procedure dictate for us. The medical term for fainting is called syncope. Syncope occurs as a result of decreased blood flow to the brain, causing a loss of consciousness. If this occurs, lower the person safely to the floor or another flat surface, such as the bed, and place them on their back. Elevate their legs, unless they have been in a serious injury. By elevating the legs, blood flow will naturally travel back to the heart or brain. As you wait for help, assess the person. Are they breathing? Are there any injuries? Keep them laying on their back for several minutes at minimum, or until the nurse gives you the all clear to assist the person to get up. This is a list of other potential emergencies. They'll be covered in more detail later in the course. Emesis is the medical term for vomiting. Nursing assistants will need to keep an approximate total amount of emesis, as this is considered an output of liquids. We'll measure subjectively as small, medium, or large emesis. Myocardial infarction, or MI, is a term for heart attack. Hypo or hyperglycemia is associated with diabetes. Hypoglycemia is low blood sugar. Hyperglycemia is high blood sugar. Seizures can vary in severity, with some being just staring out into space, to others being full-body convulsions. A transient ischemic attack is known as a mini-stroke. This means that a small portion of a bigger clot has broken off and traveled to the brain and wedged itself in a vessel. The body normally can recover from a mini-stroke in 24 hours. A cerebrovascular accident is the main stroke. That is when the big clot travels to the brain and wedges itself in a vessel, cutting off blood flow to that region. There can be permanent damage. Now we'll talk about official bed-making techniques. Sleep is a natural period of rest for the mind and body during which energy is restored. Typical adults will need between 7 to 8 hours a night for the body to fully re-energize. How much sleep do you get? Looking at the factors that affect how residents sleep, such as noise levels or problems with odors, would any of those explain why you may not sleep so well? Resident rooms. Resident rooms are really resident homes. These individuals pay a large sum of money to be living in the nursing facility. We as staff need to respect their room as their home by allowing them privacy to be alone if they want to, and always knocking on the door before entering. Every resident room will have some basic supplies that are provided to help meet the needs of the resident. Most residents will have their bed. However, some will prefer to sleep in a recliner to help them breathe better when they sleep. All residents should have a bath basin to be used when a partial or complete bed bath is needed. Washcloths should never be directly placed in a sink to get wet or to rinse. We use a bath basin and fill that with our water and place the washcloths in the basin. Depending on the resident, some may choose to have a bedpan available or a urinal. The emesis basin is typically used by residents if they are having an emesis, or can be used to spit if they are brushing their teeth while in bed. All residents are required to have fresh water in their rooms. There will be a water pitcher, unless ordered by a doctor to do otherwise. Curtains, call lights, and other hygiene items, such as toothpaste and mouthwash, will also be part of the room. As CNAs, you will be responsible to make sure the items are stocked. Think of yourself as the personal paid attendant for the residents you're caring for. You will be responsible as well for making sure that the room is neat, according to how the resident prefers it to look. The beds should look very neat and impressive, as guests of the resident will see this right away. Restock the room when supplies are low. The lack of restocking can be very frustrating to other nursing assistants who will need to run to grab the supplies in a situation that is usually most dire. Please help each other out. Let housekeeping know if the bathroom is in need of cleaning. Finally, the last thing you should check before leaving the resident's room is to ensure that the call light is within the resident's reach. This is their lifeline. Even if the resident isn't in the room, have the call light visible for the resident when they return. Bed making. Here we go. Bed making is one of the skills that you will be taught in lab. Although there may be many ways to make a bed, the technique that is taught in lab is the technique that will be judged at state testing. There is one way to make a bed for state. To prevent infection, gloves should be worn when removing the dirty linen. Just because you can't see something doesn't mean that something contagious isn't there. We have many germs that are very small. Raise the bed to a waist-level height to provide proper body mechanics. Always roll the dirty linen away from you so that the dirty is always contained inside the blankets. Never shake the linens as you remove them. You could cause airborne transmission of microorganisms. Also, bag the dirty linen. Put the clothes that are dirty or the dirty linen into a bag prior to leaving the resident's room. This prevents contact transmission of microorganisms. After you have put dirty linen away, take off your gloves and wash your hands. At the end of bed making, also ensure that the bed is wrinkle-free. All of the linens are smooth. This will look neat, but also can prevent pressure injuries on the skin. Terms we use include occupied bed and unoccupied bed, as well as closed bed and open bed. There are several types. The first is closed bed, also known as unoccupied. This means the resident is out of the bed and the sheets and bedspread are pulled up to the head of the bed, the HOB. During lab, this skill is taught by using clean sheets. Everything is brand new, and we make an unoccupied bed. Typically, sheets are not laundered every day in a facility, but for our lab, you will practice with clean sheets. A second type of bed is the open bed. This implies that the sheets and bedspread are folded down to the foot of the bed, FOB, so the resident can get into it to sleep. They may also be pulled down about 6 inches so that the resident can easily lift the blankets and climb in their bed. Another type of bed making is called occupied bed, and that will be a skill that is taught in lab. Basically, the nurse aide will change out the sheets and possibly the bedspread while the resident remains in the bed. Examples of people who would need an occupied bed change would be the dying resident or resident who has doctor orders to be on bed rest. We're next going to talk about positioning. Positioning is the act of helping residents into positions that promote comfort and good health. Part of the responsibility of a nursing assistant is to help reposition residents that cannot move on their own at a minimum of every 2 hours. One concern with repositioning is the threat of causing shearing. Shearing is rubbing or friction resulting from the skin moving in one direction and the bone underneath being fixed in the opposite direction. We can prevent this by using a lift sheet, also known as a draw sheet, or another type of lifting appliance, such as the incontinent pads. This will be another skill we practice in lab. By placing something under the resident, we can lift the resident up off the bed and the skin will not be sheared by pulling the skin across the bed. Another way to prevent shearing is to keep the bed flat or have the head of the bed at 25 to 30 degree angle. This will prevent the resident from sliding down in bed. That can happen. Here are 10 rules of proper body mechanics. These rules will potentially reduce your risk of injury. Assess the load to determine if you will be able to lift the object or person safely. When in doubt, ask for help. Think and plan ahead prior to moving. Are there objects in the way or potential risks, such as a wet floor? Make sure you have a wide base of support, meaning that your feet are at least 12 inches apart. Face what you are lifting while keeping your back straight. Our strongest muscles are in the thighs, so this means bending the knees and lifting from the thighs, not your back. Tighten your stomach to help take the weight off the spine and keep your spine in alignment. Keep the object close to the body as this decreases stress on your back. Do not twist as you lift, as this increases the stress on your back. If at all possible, push an object rather than lift it. When you lift an object, you must overcome gravity to balance the load. When you push an object, you just need to overcome the friction. 5 basic body positions that people can be placed in. The supine is a person lying on their spine, on their back. The person is on their back with a pillow under their head and a pillow under the lower legs to elevate the heels up off the mattress as comfortable. Lateral is a side-lying position. They can be laying on their left or their right in a lateral position. Pillows are placed to support the arm, the head, the lower back, and between the legs. Prone is lying on the abdomen or your stomach. Most often, residents do not sleep like this. Fowler's position is a reclined sitting position while in bed. 2 types of Fowlers include a high Fowler's position. The bed is at a 60 to 90 degree angle for high Fowlers, or a semi-Fowler's position, which is more common at 30 to 45 degrees. The last one is the Sims position. This person is in a left side lying position for Sims. Their right leg will be flexed with a pillow to support it. And this position may be used to give rectal suppositories or take rectal temperatures. The care plan will determine how often a nurse aide will need to reposition a resident that is unable to move on their own. Most often, the resident should be repositioned every 2 hours and PRN as needed. Some residents will need special equipment to help with positioning. If a resident has recently had surgery to repair a broken hip, the doctor will perhaps want an abductor pillow to be used when turning a resident to prevent one leg from crossing the other. A trochanter roll is like a sandbag that prevents a leg from turning to the side while lying in bed. The roll keeps the hip from rotating. The image on this slide is of the abductor pillow. Wheelchairs can be the main mode of locomotion for some residents. Here are a few guidelines for use. Most often, the wheelchair will need to be pushed from behind. The exception will be when trying to get on an elevator and or going down a ramp. A wheelchair will need to be pulled on an elevator to prevent toppling out a person in the wheelchair. And to prevent the wheelchair from gaining too much momentum down a ramp, the nurse aide and wheelchair will go backwards down the ramp, so the wheelchair can be controlled by the nurse aide's body. Before a resident can be transferred in or out of a wheelchair, make sure brakes are on and locked to prevent the chair from moving. Unless a care plan specifies differently, if a resident is being pushed in a wheelchair, foot pedals will always need to be on to prevent the feet from being run over or the ankle from being twisted or broken. Mechanical lifts. While being trained here at NICC, no student will be able to use or even help use a mechanical lift. There are different types of mechanical lifts for you to become familiar with, and as you work, you will practice with these. Some that are used to assist residents to stand up, and others are used when a resident is not able to bear weight. Never use a lift without proper training, as accidents may cause major injuries. Always follow the facility policy and procedure for using these lifts. 2 people are required to be present when using a lift. No one under the age of 18 can run a lift, but a person 16 years of age or older can help assist the resident while they are being lifted. Ensure that all straps are in proper place and in good shape. When transporting the lift from one area to another, extend the legs of the lift to its widest placement to increase the base of support. Wheelchair and beds should be locked, and the lift should remain unlocked or as specified by the manufacturer. Ambulation is the medical term for walking. Some residents will not require assistance with ambulation, others will. If working with a resident that is visually impaired, keep in mind that the resident may want to walk next to you or slightly behind you and use you as a guide. You should walk at a pace that is normal for the resident. If you see potential changes in the path, such as needing to turn or approaching steps, you should give warning to each resident. Gait belts. Gait belts are used whenever a resident needs to be assisted to a standing position or to provide stability if ambulating. We are never to pull on residents' arms, underarms, shoulders, or their pants. To prevent physical injury to the resident or staff, if the resident cannot bear weight, a lift should be used for the transfers. The belt should be placed around the waist, as it typically is the heaviest part of the body and is the center of gravity on a person. After the gait belt is on, the resident is encouraged to help as much as they can to transfer. We will review this skill in lab. This concludes Part 3 of Module 2.